So in the report, we highlight 5 items to consider. And through this presentation, I'm going to go through each of these and kind of give you some of the highlights from each section. Next slide. So the first one is the growing demand for healthcare employees. And this section really starts to get at the motivation for why we decided to write the report and embark on this project. Next slide. So this chart here just shows you the top 5 healthcare careers growing between 2016 and 2026. And as you can see, they're growing in very large numbers. And we know that between 2016 and 2026, 2.4 million new healthcare jobs are estimated to be opening up, requiring a wide range of skill levels and education and training. Next slide. And at the same time, we know that there's a growing number of individuals with criminal records. This graph here shows specifically the prison population, but when looking at people with just an arrest or criminal record, it's estimated that over 70 million people have an arrest or criminal record, and collateral consequences, as Josh was talking about, can have serious consequences in preventing them from employment. Next slide. So in this second section and in the future sections of this report, we get into some methods that can help to properly match some individuals with criminal records to healthcare employment. First, here in this section, looking at criminal record screening. Next slide. So criminal record screening comes up in multiple instances when seeking healthcare employment, not just when ultimately applying for that job, but also in the initial stages of getting the education and training needed for that job, as well as the applying for an occupational license that is needed for the vast majority of careers in healthcare. So we kind of wanted to look at some of the barriers and opportunities in this section here. Next slide. So first, just to highlight some of the federal restrictions related to employment, there's the system for award management, and this ensures individuals ineligible for federal contract payments do not receive them. So individuals can be determined ineligible for this for crimes such as financial fraud and tax evasion. And then there's also the list of excluded individuals and entities. And this list has individuals and entities that healthcare programs are prohibited from reimbursing with federal funds. So for example, a healthcare provider could be penalized for employing an individual on this list. And individuals can get on this list for crimes around issues such as Medicare, Medicaid fraud, patient abuse, those sorts of crimes. And then finally, there's the long-term care regulations, which are created by the Centers for Medicare and Medicaid Services. And these are prohibitions on long-term care employers from hiring personnel having committed certain types of crimes around abuse, neglect, or exploitation. So while there are definitely certain restrictions on who can get employed in the healthcare sector, there's also a number of opportunities. So Center for Medicare and Medicaid Services did award grants to many states for the National Background Check Program to design and implement background check programs that have clear and consistent requirements, and also include a waiver process that allows for independent review of an applicant's criminal record. And while these grants have ended, the technical assistance website is still up for others kind of interested in seeing a model for developing their own background check program. And then there's also the importance of the clearance of criminal records. Just this year in 2019, a study by Prescott and Starr came out on people with criminal records in Michigan, finding that of those in Michigan who were eligible for expungement of their criminal records, only 6.5% had their records expunged or removed within the first 5 years of being eligible for it. So here, just from this study alone, we see that there's potentially a big opportunity to increase these numbers. And on the federal level, to help with this, there's the National Clean Slate Clearinghouse website, which provides up-to-date information on current policies for criminal record clearance, resources for legal service providers, as well as resources for individuals looking to clear their criminal records through providing a list of legal service providers in their state. And then finally, there's state fair hiring laws, as we've seen a lot of states passing laws like ban the box, as well as opportunities through litigation where individuals have been able to challenge legal barriers and get them removed when courts have found them unduly or overburdening. Next slide. And then in the report, we also highlight 3 occupations that are at the entry level of healthcare that have been successfully filled by people with criminal records. Of course, healthcare occupations are not limited to these 3, but we wanted to highlight 3 that have really shown a lot of promise for this population. Next slide. So first is certified nursing assistants. This is an occupation in high demand and requires a relatively short and inexpensive training. It does require some clinical hours and a license with often a background check, but we have seen some examples. For example, the Tri-County Care Skilled Nursing Facility in Missouri partners with their Department of Corrections to provide a work release program for incarcerated women to become certified nursing assistants and actually work at the facility during their incarceration. And then there's also community health workers, and this occupation really uses a person's experience of having been incarcerated or being in justice involved as an asset by allowing them, having them kind of connect with other individuals with a similar background to help connect them with healthcare. So for example, the Transitions Clinic Network hires individuals with criminal records to become community health workers to help connect people with chronic conditions who were recently released from incarceration to healthcare. And then finally, we highlight the emergency medical technicians, which is another career that often does require a background check, but has examples of individuals with criminal records being able to fill them. For example, Alameda County in California has a 5-month paid emergency medical service corps for young men of color who may have a criminal record to become emergency medical technicians, and has had a great success rate in being able to place them in occupations throughout the state in healthcare. Next slide. So we also wanted to discuss some of the kind of barriers and opportunities in terms of getting the training and education needed for these occupations. So in terms of the barriers in the admissions process, there can be barriers on the post-secondary education side in terms of fears by the colleges around concerns about college rankings and that sort of thing, as well as fears around whether a student will be able to complete the required clinical hours due to their criminal background, as well as some potential barriers around financial aid depending on the person's crime. But we do have some opportunities. So on college campuses, the Department of Education released their Beyond the Box guidance, which has a number of recommendations for colleges and universities to consider including people with criminal records in their student population, including delaying questions about criminal records until after an admission decision has been made, and providing training for admissions staff on how to use justice involvement information. And then we also have a lot of opportunities in prisons and jails. Particularly in prisons, there's the Second Chance Pell Pilot Program, which in June 2016 gave awards to 68 institutions. And just last week, the president announced at the Second Chance hiring event that the Second Chance Pell Pilot Program will be expanded. So more to come in that realm there. Next slide. And then on the federal side of things, there's a number of different kind of job training programs that could potentially help this population. And they kind of come in 2 buckets. The first bucket is health profession specific grants that aren't necessarily specific to people with criminal records, but could include them. And then the second bucket is reentry employment specific grants that aren't necessarily specific to healthcare employment, but again, could include that type of employment. And I did just want to highlight here that currently grant funding opportunities are open for the Second Chance Act funding out of the Department of Justice until about the end of the month. Next slide. And then our 4th item to consider are recent efforts to improve occupational licensing requirements, as really we've heard by both the public and the private sector that occupational licensing can be overly restrictive at times. Next slide. So the first item is just to eliminate unnecessary barriers in licensing, and probably the one with the easiest lift is to clearly state criminal record restrictions so that individuals know whether or not they are restricted from receiving an occupational license. And we see a good example of this with the Florida Board of Nursing, which created a matrix to simplify their licensing restrictions. And the next item is to make sure restrictions are not overly broad. We've seen a lot of efforts on this at the state and the federal level, with the Department of Labor last year providing a number of grants for states to review and streamline their occupational licensing rules. And then there's also the Equal Employment Opportunity Commission's guidance outlining the appropriate use of criminal records in the hiring process that can also be used during the licensing process. And in fact, we saw that the National Council of State Boards of Nursing advised nursing licensing boards to consider this guidance when considering whether to give an individual a license. So some of the factors included in the guidance includes considering the amount of time since a person's conviction, as well as the type of offense and how that relates to the job. And then lastly is to establish a background check program that includes a waivers and appeals process. Next slide. And then our last section is opportunities to enhance the healthcare workforce. And this section is really around making the case for employers. Next slide. So when telling employers about this opportunity, first we like to highlight kind of some of the studies that have shown lower turnover rates and increased productivity among individuals with criminal records working in the healthcare space, compared to individuals who don't have criminal records working in this space. And there's also a number of financial incentives. So there's the Work Opportunity Tax Credit, which is a federal tax credit available to employers for hiring individuals from certain populations, including those who were formerly incarcerated, as well as some state programs that are specific to the state but could include things like income tax credits. And then there's the opportunity to reduce liability through federal bonding, which can help kind of reduce some of employers' concerns when hiring an individual with criminal records. And through federal bonding, expenses that may happen related to theft or damage during the beginning of a person's employment would be covered by this federal bond. And also in this second chance hiring event that happened last week, the president announced an additional $2 million for the federal bonding program there. So seeing a lot of expansions in that area as well. So next slide. So those are kind of some of the main highlights that I want to cover in the report. There's definitely more information and details in the report, but I'm going to turn it back over to Josh and happy to answer any questions during the Q&A.
Great, thank you, Sophie. Next, I'd like to introduce Sadika Williams, General Counsel and Vice President, External Affairs at Safer Foundation in Chicago. She'll discuss some of the work that her organization and organizations like hers have been doing to connect people with employment in this area. Before I do that, I just want to announce, since we got started a little bit late, we're going to go till 2:10 as opposed to till 2 to leave a little bit more time to hopefully get to some of your questions. So thank you for that, and Sadika.
Good afternoon, everyone. I've been with Safer Foundation for 5 years, and really since I walked in the door and my first day at Safer, I have worked with my team to open career opportunities in the healthcare industry, locally and nationally. With healthcare projected to be the fastest growing industry and people with arrest and conviction records being largely excluded by healthcare employers, there was a big need to figure out how to address getting people back into the workforce and to address the significant skills gap. In Illinois, where we are headquartered, although we are in other states as well, including Iowa, We have over 40% of our adult population with some kind of arrest or conviction record. And while we are seeing low unemployment rates, the rates in certain high return areas in Illinois are as high as 27%. And we are seeing low labor participation rates around 63%. So what does that mean? We have lots of jobs and not enough people to fill them. So if you have 1.5 open jobs, so we have 1.5 open jobs for every job candidate. Understanding the need, back in May 2015, SAFER held a healthcare forum with Congressman Danny Davis, and we invited former VP of Johns Hopkins Hospital for HR, Pamela Paulk. Pam provided a compelling presentation about how Hopkins hires people with records as a matter of business, not just as a program. We had over 35 top-level healthcare executives in the room, and what came out of that was over 10 different healthcare hospital systems agreed to work with SAFER to launch pilots. And that really began SAFER Foundation's work in creating career pathways for people with arrest and conviction records within the healthcare field. Please, next slide. Next slide, please. This also led to J.P. Morgan Chase Foundation supporting SAFER and the National Employment Law Project, NELP, to engage employers in a new discussion about promising new opportunities to recruit and employ people with records. This was in 2017. This initiative aimed to expand and diversify the pipeline of applicants seeking healthcare employment in order to meet the current and projected demand for qualified workers. We held forums, in addition, in 3 cities, Oakland, California, Cleveland, Ohio, and Dallas, Texas. We also created a healthcare employer guide to hiring people with records. This toolkit is really great for all kinds of employers, those and other stakeholders as well, including workforce development intermediaries, it could be trainers, but it's great to just learn about best practices for hiring people if you just want to learn more, or if you're all the way, you're kind of, more advanced and you're hiring people with records. It will give you some guidance on how do you, number one, how do you, if you're just interested in, build critical top-down support for implementing something within your organization, but also if you've kind of been doing the work, what are some of the longer-term best practices when we think about retention and sustainability? And as a starting point for the toolkit, and as you see in front of you, I think it's always important when we are kind of educating ourselves and when we are thinking about the information to kind of look at the numbers. And here you'll see 70 million people, 1 in 3, right? Just so that when we're thinking about the pipeline, when we're thinking about people and hiring from our local communities, that, it could be someone that 1 out of every 3. So it's not just, can't ignore it. We've got to talk about how can we include people with records in the workforce. Another thing I wanted to point out, too, is better retention. In this guide, we included information from Johns Hopkins, which is really kind of the national model in terms of a healthcare employer. It's really set the example and inspired others to start their own programs. But they have better retention for people with records that they're hiring, which, as we know, also reduce those recruiting costs. And I won't steal Reggie's thunder, who is going to come after me, but we are seeing firsthand in Chicago about how the retention rates will improve. Another thing I just wanted to point out, too, when you're talking to colleagues or various stakeholders, there's a lot of perceived risk, right? I will be exposed to substantial negligent hiring liability if I hire with someone with record. But if you actually look into the case law, the risk of being sued for and winning for negligent hiring liability suit is very low. The reality is that when you hire a person with a record who has faced barrier upon barrier, challenge upon challenges, and they finally get that opportunity, they are going to be very reliable, very productive, and they're great, great employees. Another myth is that, and I hear this a lot, just talking in different places from employers, and I find that, there's a lot of misperceptions about different, whether it's federal and state laws, especially state laws. Oh, well, the law won't let me hire someone with a record, but that's not the case. And it really just requires some more education in terms of what your state law is, what's allowed by law, what are the certificates and relief that will allow someone with a disqualifying conviction to be able to work, and if there are any appeals processes that even if a person is denied, say, a license, that they can still get that license. Next slide, please. Another thing to consider, and this is probably when I talk to people all the time, I tell them it's not just the moral imperative, right, in terms of just, addressing also corporate social responsibility and kind of your mission of the organization, but hiring people with records, and I touched on this very briefly, is really just, it's good for the bottom line as well, especially when you talk to employers, their ears perk up. They're like, okay, well, why should I consider this? You have 70 million in terms of a talent pool with qualified candidates. You can reduce your recruiting costs when your retention numbers go up, and that goes to reduce turnover and increase productivity. And also something that healthcare employers and other stakeholders can think about is improved quality of care and health outcomes. We know that when we hire people from the local community, especially when you're talking about community health workers, and and interacting with the people that are coming into their clinics, whether it's FQHC, whether it's a hospital or otherwise, that in terms of signing someone up for an appointment or getting that vital information, that will improve. And there's actually a case study that's in the toolkit that gives numbers to that. And of course, the tax credits and the bonding that you heard about. Next slide, please. Another thing, before I talk about the steps that are in this toolkit for an effective hiring program, I just wanted to also mention that within the toolkit there are stories that are featured in terms of different people who have gone through these programs and who have been very successful. So when you look at the toolkit, I encourage you to look at those stories. And again, I'm not trying to sell Reggie, I'll let him talk, but we just honored one of our clients who is working with Reggie at AMITA for all his hard work that he's done. And so there are just a lot of success stories, and they show that people with records can not only just kind of maintain in healthcare, they can thrive. Another part of the toolkit is this step-by-step guide to hiring people with records. And it has much more information. This is just a very high-level look, right, for your sake, for this webinar. But there is more information in the toolkit. But one of the main things I wanted to point out about this is adopting humanizing language. We hear, and I know you've probably noticed, I've said people with records, there's justice involved. Some people say formerly incarcerated, but the thing about this population is that a lot of people have arrest and conviction records and they've never been formally incarcerated. Another phrase that people are starting to kind of move away from are returning citizens because of potential implications for immigration. So we are saying people with records, people with arrest and conviction records, but avoid language like ex-felon, convict, ex-offender. Those we should try to stay away from. Some of them, in terms of blanket bans against hiring people with records, saying I absolutely cannot, hire in terms of our company policy. And instead go for those fair screening standards. And there are a number of, of information in this guide that lays out, okay, well, what would that look like? 3 is regarding the criminal history inquiry. For the job applications, as many of us know, ban the box. And one thing, too, and I don't want to spend too much time on this, but one thing before I move on is that a lot of employers think that in the initial part, so like say on the form where you're doing your background check form, that having someone self-disclose either on that form or in an interview is going to show them honesty, right, in terms of assessing someone. But we really encourage that you do not do that because a lot of people don't even know all of the stuff that's on their background check. So I just wanted to point that out. Next slide, please. The toolkit also covers, it has a hiring manager's key for hiring people with arrest and conviction records. And you can see that on the screen. It's in the toolkit. I just wanted to point out Does a hiring manager is key, but some employers are not going to want to share criminal history with their hiring managers. A lot of employers that we work with actually keep everything in HR, and then, you know, that way, and the hiring manager is truly about the skills and the credentials and their qualifications and their experience and their interpersonal skills, but some will. So for either scenario, these are things to think about. You know, when you're making a job posting, don't just put broad exclusions on there. Really think about if it's relevant for that particular position. So it does require that employers update their policies and their postings regularly. And I'd also included in the toolkit are model employers. I've been talking about Johns Hopkins Medicine. Next slide, please. I just wanted to share with you some information about Hopkins. This is information that was actually shared when we were working with NELP in the forums, but I just wanted to give you like some real, you know, practical information, and you're going to hear from Reggie soon. But they're the largest private employer in Maryland, and for FY 2016, 50% of their workers, you know, were hired from the areas surrounding the actual hospital. And of those individuals, 115 had conviction records. Okay, next slide, please. And what they reported out in terms of factors for success is, of course, having that executive leadership, you know, support, because it's got to start at the top. But one thing that I didn't put in here, just from practical experience, it does need to trickle down in terms of HR or if it's compliance. You know, it's got to definitely be supported in order to be successful, and also screening carefully for success. In terms of the applicants that are coming in, using the fair chance hiring policies. Also in the toolkit is steps and tips on working with intermediaries that will refer you candidates. So not only, you know, you're looking to hire directly, but working with intermediaries that work with the justice-involved population to help build that pre-hire curriculum to meet the needs, as well as interviewing candidates prior to internships and training programs, and then paid internships as well. Next slide, please. Some things to think about in terms of workforce development and just best practices in retention. Just to be noted, Hopkins provides case management services, and they provide job retention services as well. And they also provide upgrading for in terms of like if a person starts entry level and they want to move up, they'll help them with education and training as well. Next slide, please. So really quick, I just wanted to go over the work that we're actually doing locally in the Chicago area. It's called the Safer Demand Skills Collaborative. And what it is employer-driven, and pretty much Safer works as an intermediary with trainers and employers in terms of what I was saying, building up that pre-hire curriculum. We have soft skills training in terms of like how you show up work, how do you, how do you interview, working on a resume, but also we have contextualized industry training that is sector-specific for healthcare. And we focus on many jobs, not just entry level, but when we're looking in terms of the career pathways, we actually work with the employers to figure that out through our collaborative meetings. Next slide, please. This is a very high overview of our work to date. As you can see, we are getting people trained in place with our healthcare employer partners in a number of different types of positions. When we started this off, we thought that we were going to have graduated pilots, but it ended up being we need everything right now because there was such a big shortage. And the retention rate, as you can see, is really high. The waiver approval I'll get to in the next slide, but someone had asked about legal services really quick. The participants who are part of our healthcare collaborative also receive pro bono legal assistance for sealing and expungement in the state of Illinois as well when they're going through the process. Next slide, please. And just really quickly, we heard a lot about collateral consequences. We understand that when we're pushing forth programs, that there are also a number of barriers that need to be addressed. SAFER worked with a number of advocates. In 2017, we had licensing reform. And what that did, just very quickly, is it stopped blanket denials based on convictions, based on the grounds of good moral character. And it created a fair and consistent process whether or not the conviction or convictions would impair that person's ability to perform the position in question for licensure. And it required rehabilitation, it required consideration of mitigating factors, and it clarified that arrest could not be used for a denial and that expunged and sealed records could not be used for denial of licensing. Next slide, please. Another pending piece of legislation that has passed both houses is for unlicensed positions. So that was on the licensing side I was talking about. This is unlicensed. We have what we call a healthcare worker registry where you need a waiver if you have a disqualifying conviction. And not all convictions require a waiver in Illinois, but if you have one, you need what you call a healthcare waiver. There was a need to address the law so that healthcare employers wouldn't have to wait to get people on the healthcare worker registry and a waiver because they were being required to have that, to actually make a conditional offer before a person could apply for a waiver. So what this is going to allow to do, it's going to allow organizations like SAFER and pro bono legal service organizations to get that healthcare waiver registry up front before they could even receive the job offer. So that way it's streamlining the whole process and we can continue to build up the pipeline. Next slide, please. I think that's it. But I'm happy to answer any questions. Here's my information. Thank you. And next you'll hear from Reggie.
Good afternoon, and thanks, Attica. As Josh mentioned at the beginning of the presentation, my name is Reggie Allen. I am a talent acquisition consultant with Amita Health, formerly President's Health. We just went through a large merger. And the areas that I work in are workforce development, diversity, and inclusion, and it's all through our mission-based recruiting efforts here at Amita. Next slide, please. Go ahead and skip to the next slide. As I mentioned, we are now one large healthcare family, which includes Amita 1.0, Legacy Presence. As an organization now, we are a system of 19 hospitals, 230 plus other sites of care around the Chicagoland area. We are now the largest healthcare system in the state of Illinois with 26,000 employees. And as you mentioned as well, we are service of almost 7 million residents in Chicago and surrounding suburbs. We cover a pretty large area in the Chicagoland area. We're a faith-based organization, largely Catholic, but we do have an Adventist division as well. And for us, it's about compassionate care, serving the communities where we exist. And one of the ways that we serve those communities is look to hire from those communities. And we work with a number of different vulnerable populations, as we call it, which includes folks who have arrest and conviction records. Next slide, please. Just a little more information about Amita Health, Presence Health, and the combined organization. And you can see some of the numbers there. So next slide. Again, I talked about the area that we covered. The small area to the right says Chicago region. It's one of the 3 regions that we have. That's all of Chicago. And then you can see in the other areas, the areas that we cover here in Chicago. So we have sites all over the place here in the Chicagoland area. Pretty large organization. Next slide. Few awards and recognitions about the organization. One of the ones that I wanted to point out and why we included this is just our award for improved care for underserved populations. That's something that we're very serious about from the top of the organization all the way down. It's something that we don't just talk about, but we live and breathe every day. Next slide, please. And as Sadaka mentioned earlier, we of course work with SAFER Foundation. We've been working with the SAFER Demand Skills Collaborative for about 2 years now. I'd like to say we're responsible for all of the hires that Sadaka mentioned in her slide. We are not just yet, but the numbers are growing each and every year. We've hired in all of the areas that she has mentioned on this part of her presentation, but on the next slide, I'll mention some of the other areas where we've had success in hiring folks with arrest and conviction records. Next slide, please. Okay, and just one thing that I'll mention on the previous slide, and I believe that someone had talked about some of the areas of growth over the next several years and kind of where we are now and what our needs are. CNAs is an area where we have a large number of needs. Medical assistants, patient care techs are areas where we have a large number now, and projections are that those numbers will continue to grow pretty significantly over the next couple of years. So there's been a lot of focus and kind of push with the organizations that we work with to target those areas. And it's something we've done with the SAFER Foundation. There's a few organizations that we kind of partner together with. So it's kind of a trio of organizations to help to address some of those needs. But beyond those listed on the slides previous to this, we've had success in hiring these folks in our logistics area. The person that Sadaka mentioned that we honored recently at their gala this year started as an environmental services rep, housekeeping, and he is now an anesthesia tech. And we've seen significant growth, and he's one of the many success stories we've had with some of the SAFER hires. So we're really proud of that. So it's not just limited to entry-level positions. We're looking at other levels as well. As you can see here, we're talking about nursing. We have a candidate in the pipeline now for a nursing leadership position, actually. And then food service, patient care tech, patient service rep are some other areas where we've had success in hiring SAFER candidates. Next slide, please. And the reason for our success, there's a couple of things that we talk about internally, and Sadaka had mentioned a few things as well. And our first is the same as the first that she mentioned. But a big reason for our success is support from leadership, from the C-suite. And here at AMITA, and when we started, it was President's Health before the merger, but we had support in the organization from the very top all the way down. Our relationship was driven by our chairman of the board, who had a relationship with someone at SAFER, had some discussions about our organizations working together. I started in my position. It was a brand new position about 2 years ago. And in my very first conversation with leadership, they talked about working with the SAFER Foundation. It's an organization that I'd known about and had already kind of reached out to. But I was really excited to see that support was coming from the top, not only from the chairman of the board, from our CEO, from our chief human resources officer, who was a huge proponent of the work and just provided support, helped us to remove internal barriers as we kind of move forward with this work. So that's been key in us having success here in the organization. The next thing is a roadshow, what we called it internally, but it was just about getting out and educating the entire organization, especially the hiring managers. Because in some of our initial conversations, that's where we saw some of the pushback. These were the people who were going to make the hiring decisions for some of these candidates that we were presenting. So we had the opportunity to sit down with them and talk about the work that we were looking to do. We talked about just inherent biases that we all have. But then we took a lot of the information that was shared in the toolkit that Sadaka referenced, some successes that had been had by other healthcare organizations across the country. And we also, as we started to get a little bit of traction, we wanted to humanize this effort as well. So we were able to bring some of our hires, some of our success stories in front of hiring managers, in front of our talent acquisition / recruiting team to talk about their journey. So when folks would think about working with people who have arrest and conviction records, they don't just immediately think, okay, next, let's go on to the next candidate. Because we found, and it's been proven over and over and over again throughout these past 2 years, that there are a ton of folks out there with these backgrounds who are very skilled, who have varying levels of experience. They definitely have the will and desire to work with us as an organization. And now we have success records that we can tout as we talk about our work across the organization. And again, we educated everybody across the organization, our sourcers who do kind of the initial screening. A lot of times the candidates that are submitted to us from the SAFER Foundation are put into the hands of the sourcers to do the initial phone screens to kind of get the process going. And we as an organization, we share the background information with talent acquisition, with recruiting, but not the hiring managers. We keep it in HR. So again, the sourcers, recruiters are aware. We spent a ton of time educating hiring managers across the organization, our onboarding agents, just everybody who's part of the process is very important to us having success. The SAFER Foundation, 5 days a week, for the past 2 years, we're talking about the needs of the hiring managers. We want to make sure that when we submit someone to a position that there is a high chance for success. So we're not, to use a term that we do in HR, we're not going to throw resumes against the wall. We're not trying to force anything down anyone's throat. We want to do a good job of matching the candidate to the position. We want to make sure they're as qualified as most of the rest of the applicants that come from the outside. So when a manager see them, they feel like it's a good, solid applicant. So with that, there's a lot of feedback. If there's a reason that a candidate is not considered or is not extended an offer, we want to share that information with the SAFER representative. They in turn take that information and use it to help to better screen and prepare their candidates. So as we continue through the process, it's always evolving and always getting better. And we've seen the fruits of that labor as we progress in the effort. We also spend a lot of time on site at the SAFER Foundation. And this is something that I think is a benefit to a lot of the candidates. A lot of these folks have been to 1,000 interviews. They've had 1,000 rejections, and they're worn down. The level of hope has decreased a little in some cases, a lot in other cases. So to have an organization out there that they are familiar with, they know about, who is able to say, yes, we do work with folks who have backgrounds. We have had some success in hiring. These are the areas that we are looking to hire in that you may qualify for. We also talk about career pathways. We're not just satisfied with hiring someone into the organization and having them sit there. Now, if they choose to do so, it's their prerogative, and they certainly can. But we also want to be there to support them as they progress within the organization or desire to progress, which is a lot of what we did with the candidate that was recognized here recently. So we spend a lot of time just interacting with SAFER clients. The process I've talked a little bit about, but that's been very important. Sadaka mentioned the waiver. The waiver has been crucial. It's been a great way to streamline the process so that we know when that person comes in. They do a fantastic job of submitting the candidates. They come in with a little selling sizzle, as we call it, selling the candidate for that specific position. Includes a resume. It includes the waiver, any certifications that they have. So they're packaged very nicely when they come to us from SAFER, and we know that they are eligible, and so we've gotten over that hurdle. And the next thing is just presenting them to the hiring manager for the open positions that we have. So that process has been, we work on it continuously, but we have a pretty good process. Everybody's aware and involved, and it helps us to be successful here. And we also continue to provide support. I talked about career pathways, but SAFER continues to provide support for their candidates for at least a year. In many instances, it's much longer than that. Very phenomenal in that. But we partner with them to support in those efforts. So we keep in constant contact with the associates who are hired from the SAFER Foundation, with the hiring manager. We're letting them know that we are a resource to be there to address any questions, any challenges, any issues. From either side. And we found that does goes a long way in helping a level of comfort for both sides. And then finally, the toolkit that Sadaka referenced, we dug through that thing, cover to cover in the very beginning as we started these efforts. A lot of really good information in there, information about best practices. And it's good to reference back and look at some of the numbers and the information and we share that across the organization. So we love the toolkit, so we reference it very, very often. Next slide, please. And that's a toolkit, so yeah, I am very familiar. Next slide. So that's it as far as the presentation. I'm happy to answer any questions that anyone may have about just things that we've done, some of our best practices, to elaborate on those a bit further. Let's talk about any challenges that we've had, and trying to get this thing going around here. So happy to address any questions here at the end.
Excellent. Thank you, Reggie. And thank you, everybody. We've got just a bit of time here towards the end to answer questions. As you can see, the contact information for all of our presenters is on the screen here. And feel free to reach out to them if we're unable to address your question in the limited time we have here. Two things. First, the most common questions we've got is whether the slides will be available. They will be, and a recording of the webinar along with the slides will be posted in the coming weeks on the NICCC and the NRRC website, and we'll have links for that later on. One of the questions we got, and I'll direct this to Sadek, and perhaps Reggie may want to come in as well. We talk about collateral consequences as these sort of legal barriers, and it seems like those are largely kind of a licensing issue when we talk about healthcare field, about healthcare. But then we also talk about sort of the, just the challenge of getting an employer to hire somebody who has, become licensed and already sort of overcome that barrier. So the question is, what are placement rates, if you have any idea, like once a person overcomes those licensing hurdles to actually getting a job in the sector? And I would add, maybe if you have an idea of sort of the relative challenges and the different sort of challenges raised by the licensing barriers versus an actual sort of getting the job.
Reggie, please feel free to chime in, but
okay.
I would say just to flag, in Illinois, and every state is different, we have we have unlicensed positions that don't require, a license, that still, there are disqualifying convictions that require a healthcare waiver. And then for our licensed positions, we have those challenges as well. And so that's why with both those policies, one first started with licensing, and I'm sorry, that was over 100 different occupations, including healthcare, right? So if you're looking at the legal challenges for licensing, it was just making sure that people weren't pulling, for a different agency, or licensing boards weren't pulling that full conviction and saying, I'm just going to toss this whole thing away, Actually looking at the relevance in the EEOC-like factors, because those are included in that legislation in terms of how long ago did it happen and what positive things have happened since then. On the unlicensed side, right, so I just want to point out, too, there is confusion, right, as this is new territory, this is new industry, in terms of how the unlicensed and licensed positions work with each other, because there's two different state agencies, or actually there's two different in healthcare working with each other. The Department of Public Health in Illinois does the unlicensed, and IDFPR, the Illinois Department of Financial and Professional Regulation, does the licensing. So making sure that employers understand that not everybody will need a healthcare waiver that comes in. There are certain qualifying convictions, what they call, where they don't need a waiver, but also that if a person is licensed, that they don't need a healthcare waiver. So there's that employer education component that is needed. But in terms of the placement rates, now I don't know specifically just for licensed positions, but when I showed it was a 91% retention rate, which is amazing. And Reggie, do you want to share your information in terms of retention rate for safer placement?
Yeah, I was just thinking about that. That's something that I failed to mention previously, but we've had a retention rate that's up around 97% for safer placements. So that goes a long way in me making the business case for hiring folks with this who may have arrest or conviction records. And I say all the time, I'd love that if we as an organization had a 97% retention rate. We do not. So it's an easy case to make to talk about retention amongst this population. And as far as like licensed or unlicensed go, we've done a lot of work with our associate labor relations team who interacts with EEOC, IDFPR, IDPH, the organizations within the state of Illinois, because we found that the area can be kind of gray sometimes. So they've worked more as an advocate really for us internally in helping to get over some of those hurdles and helping to clear the way for some of those folks to be hired, which in turn opens up the door for folks coming after with similar backgrounds. So we've done a lot of work in that area to help advance the process.
And also just something to point out too, the recidivism rate for the individuals that we placed is like very low. It's like, I don't even know the exact percentage, but it's very low, and it was like somebody just jumping a median or like doing some kind of traffic violation because they were trying to get to work on time.
Right.
So it's proof that living wage employment and career pathways are very effective in terms of helping a person, getting them reintegrated back to the workplace, and then they can have a living wage for their families.
Correct.
Excellent. All right. Well, we are at time a bit over. So if we can have the next slide, and I apologize, I know there are a lot of questions we didn't get to, but please write down these email addresses, and you can reach out to me directly, and I'll be happy to put you in touch with these people as well, and I'll give you my address. I do want to flag some of the resources available, the links here. Like I said, these will also be available on our website in the coming weeks. We have links to the Clean Site Clearinghouse, the National Inventory of Collateral Consequences, the Health Care Toolkit. A lot of folks have shown interest in the Q&A. Is there as well, and additionally the Department of Health and Human Services report that Sophie spoke about. I also want to note that later in the fall of this year, the Justice Center is planning on convening a healthcare providers for training on workers with criminal records. And for more info on that, you can contact Sherry Moses at SMOSES@CSG.org. And if you are subscribed to our mailing list, if we can have the next slide, you can get some more information about that as it comes up. My contact information is there as well, and like I said, feel free to reach out to me, and I'm happy to connect you with our panelists. So again, thank you everyone for joining. I want to say thanks again to Sophie, Sadika, and Reggie for their fantastic presentations. And we encourage you to share these resources and what you've learned here with your networks, and hope you have a great day. Thank you.
Thanks, Josh.
Thank you.